would like to welcome you to It Takes a Village, a town hall conversation on homelessness in DeKalb County. How Human Services became part of this initiative. If some of you all, I'm sure you all remember, about 2 years ago there was a deep freeze, right? And the temperatures were constant below the 30s in DeKalb and other parts of the metro region. In that, there was a public safety response in DeKalb County that was also part of our community development leadership and COO Zach Williams' leadership, where we had to utilize other facilities within the county to help our unhoused populations. In that response, senior centers were utilized, and senior centers fall underneath my purview. And so in that, we learned a lot to get through that winter season 2 years ago, and it was quite a challenge. But we also learned that it takes a coalition, it takes wraparound services, it takes a holistic, comprehensive approach to really come up with solutions for those that are experiencing homelessness and are temporarily unhoused or permanently unhoused. And we saw several thousand people this past winter in our senior center in Chamblee in North DeKalb. We also know that we saw youth and other individuals that had a myriad of challenges that was leading to the instability. And so I want to thank my administration, CEO Thurman, COO Zach Williams, Director Mitchell, who you'll hear from later, and an extension to Frontline Response, Terry Tucker, who was part of it for this year's solution, to help us, and all the others, the volunteers, the City of Decatur, and that collaborated several workshops and discussions along that way with many of the nonprofits and others in the area. Also, our public safety team and our human services staff. I'd like to say thank you all to help us for all the help that you have provided for the unhoused community here in DeKalb County. It was with compassion that we were leading, and with compassion that will stay with us as we move forward in the discussion. Today's town hall, just a little overview, is we're going to be looking at factors that are contributing to the homelessness, such as increased rent, mental illness, low wages, lack of affordable housing. The town hall is designed to start a conversation on how we can effectively collaborate to deal with these challenges in DeKalb. The first panel will take a look at current homelessness that is contributing to the increase in homelessness. We will explore trends and ways in which homelessness can be addressed in the county. The second panel will discuss current housing and homeless services that are offered in the county. We will explore successes that are working for service providers, as well as the challenges that they face. Finally, we will explore the integrated systems and other solutions that will help bridge the gap and assist in those that need local service providers. Finally, the third panel will look at strategies. It will also be discussions around policy and ways to have Q&A to engage and have further questions to bring us further along the continuum of care that's needed to provide for this population. A box will be on the table right over here next to our moderator, Dr. Bailey. And so I look forward to all of the contributions that you all are going to provide. But next up, I would like to introduce the person that made this all possible, Commissioner Robert Patrick. And I want to thank you personally for inviting me here to do the welcome. And so Commissioner Patrick will be given a few opening remarks. For those of you who are not aware, Commissioner Patrick represents District 1 and is serving in his first term. From 2022 to 2024, he was the Board of Commissioners presiding officer and is currently serving as the Deputy Presiding Officer. He has been a champion of vulnerable communities, most notably those who are on the verge of eviction. His office funded the St. Vincent de Paul's Eviction Assistance and the organization's first motel to hotel program in DeKalb County. He also supported the implementation of broad-based tenant protections and statewide eviction resolution program at the state. He also advocated at the federal level to reduce or eliminate 7-year credit history for residents who were evicted due to COVID-19 pandemic. So without further ado, I would like to introduce you this morning to Commissioner Robert Patrick. Thank you.
Thank you very much for that warm introduction. You know, I joke with my staff sometimes, of all the things that we end up dealing with, I really wanted to just fix the sewer system for DeKalb County. But, you start working on one thing, and it leads to another, and leads to another. And so all of a sudden, we're here together in a room to talk about a bigger issue that's confronting all of our communities, and how we move forward from that. Well, good morning. I am Commissioner Robert Patrick and represent District 1 here in DeKalb County. For those of you that don't know, District 1 includes the cities of Dunwoody, Chambly, Doraville, Tucker, about 70% of Tucker from Hugh Howell 78 north to North Lake Mall, as well as Henderson Mill. Two communities that are important, very active, North Crest, as well as Embry Hills. Well, first, I'd like to thank each and every one of you for coming out to this town hall this morning. In fact, we have almost a full house with us this morning on this important topic of homelessness. In 2024, homelessness appears to touch all of us in some way, whether it's someone you know who's struggling with addiction or mental health, living on the streets, or perhaps you have daily encounters with unhoused at your local gas station or the grocery stores. Or maybe you've seen someone with a family piled into a car sleeping in a parking lot. Or you've peeped out of your backyard window and noticed tents in the nearby woods. Today, the homelessness crisis touches all of us, literally all of us. I would like to personally thank Ms. Kenyatta Turner Burrick, who you will meet later this afternoon, for putting this issue on my radar. Ms. Turner Burrick is passionate about housing and advocates for those who are in need in our community. Back in February of 2021, she alerted me and my chief of staff to what was happening in the housing and unhomeless areas within DeKalb County. This was before the issues became a daily headline. She sounded the alarm about the tactics of corporate investors, landlords, and financial hardships they were creating on families in DeKalb County. She shared how there is very little or no safety nets for people on the verge of homelessness. She also told us how rights of tenants here in Georgia are relatively limited. And she sounded the alarm on a number of people losing their homes and becoming homeless. The fallout of the pandemic, lack of affordable housing, inflation, low wages, lack of mental health resources, and outdated social policies such as evictions that remain on a credit report for 7 years have created a perfect storm in this homeless crisis that we're currently experiencing. Many of us sitting here in this room today are one of or two paychecks away from homelessness ourselves. We need to do something different here in DeKalb County because the homelessness crisis can touch all of us in our individual lives. Over the last 3 years, my office has been looking into the homeless situation in DeKalb County, and we have concluded that it will take a village, literally everyone here is part of that village, to tackle this multi-layered and complex issue. This is not something that my office, District 1, or even 10 other agencies and organizations can solve alone. Sure, we can all work individually in our silos and focus on our own mission, but we really, really want to accomplish much, much more. And I think that working together collaboratively is going to be the solution to this issue we have. Today, the homeless crisis touches all of us, and because it touches all of us in some way, it will take all of us to fix it. Whether you're a city manager, a volunteer at a church, or a retired school teacher, or corporate executive, there is a role for each one of us to play in this solution. Today's goal of the town hall is to begin the conversation on how to tackle homelessness in DeKalb County. We will hear from a broad range of stakeholders and experts in this field that will share ideas on strategies and how to shed light on challenges that we must overcome in DeKalb County. It is my hope that not only will you leave here with some key takeaways, but today's town hall will motivate you to get involved and take action. This town hall is only one step because we must keep working to move the ball forward. We will take all of these ideas and recommendations and begin the process of putting them together in order to take collective action. After today's panels have concluded, I will let you know how to get involved and the next steps during my closing remarks. I hope you all will join me, and thank you for today's conversation. Thank you for being here. Appreciate you.
Thank you, Commissioner Patrick, for those remarks. Let me introduce Dr. Jeff Bailey. Dr. Bailey is CEO of Panorama Strategies. Did I pronounce that right? Okay. And Senior Advisor to CEO of Frontline and his research arm, Freedom Institute. He also works with leading foundations, think tanks, universities, and nonprofits on program design, organizational growth, and strategic planning. Prior to this, he taught at Cambridge University and was the managing director of the Center for Social Justice, a policy think tank in London focused on poverty and economic opportunity. He is a senior advisor at the University of Virginia's Advanced Studies and Culture Foundation and sits on various boards and advisory councils focused on public policy and civil society. He lives with his wife and 3 children in Washington, D.C. Please welcome Dr. Jeff Bailey.
Thank you and good morning. It's great to be here with all of you. I actually flew in last night, not from Washington, D.C., but from Denver, where it is cold. The mountain air is still strong there, so thank you for welcoming me with some Atlanta weather here this morning, some sunshine. This is great. And it is great to be with all of you, and thank you for having me. Thank you, Commissioner Patrick, and everyone who's been involved in pulling together what is an essential conversation. And it is an essential national conversation. Many of you will know the statistics that we're dealing with. If we compare 2023 with 2022, we have tens of thousands of people who are homeless in America just in this last year compared to the year before. It's a 12% increase. That is the largest increase in a single year in homelessness, I think, since the federal government started keeping track with its point-in-time counts in 2007, the largest spike in a single year. You will see how this plays out in this context here in DeKalb County. But again, thinking about what is happening nationally, we're also seeing people move from being housed to being homeless faster, at a faster rate than ever before. From 2020 to 2022, the number of people who became homeless for the first time increased by 30%. And we are seeing far more people move directly to homelessness from a lease. So that distance has decreased significantly. We're seeing now more unhoused families with children who are homeless. We are seeing an increase after years of great success nationally and also here in the Atlanta area with veterans experiencing homelessness. We are seeing now the increase again in these last couple of years of veterans now struggling with homelessness. And some of this, of course, is compounded by all the things that was mentioned in terms of the complex reasons behind this, but we're also seeing the effects now of the waning or ending of pandemic era supports that were available. Now, as those are disappearing, we're beginning to see the consequences of this. What we do know nationally is that there is no quick fix to this. There is no silver bullet, but those who are addressing it most effectively have started by doing exactly what DeKalb County is doing right here, which is beginning to pull together the relevant people from across the spectrum: government, nonprofits, churches, policymakers, you name it, across the board, who are coming together to think about a complex problem that no one single group can fix. This is a problem that is a long, slow walk, but we are seeing examples of success around the country, and they all started like this here. So it's a great privilege to be part of the beginnings of something like this that's happening here in DeKalb County, and we've got a great group of people on different panels here to be able to speak to this. And so we are going to get started in this first panel here by understanding where we are at. I'm going to introduce a couple of folks who are going to give us an overall picture of things, and then the other panelists here in advance, so that we can move forward with things here in an efficient way in this first panel. To give us an overview of the state of play, I'm going to ask first that Alan Mitchell present some slides, followed by Mike Carnathan, who will be presenting as well. I've been told that you're under strict orders. You've got 10 minutes for your presentations here so that we've got time for others as well. But let me introduce them and the others as well. Alan Mitchell is the Director of the Community Development Department for DeKalb County. In this role, he oversees the use of HUD funding to help develop viable urban communities within DeKalb County that benefit low to moderate income people in particular. You all have in your packets everyone's bios, so I'm just going to give brief orientation so you know who people are, but you've got their longer bios in your packets. Followed by Alan Mitchell. Mike Carnathan is the manager of the Research and Analytics Department at the Atlanta Regional Commission. He is also one of the founders of Neighborhood Nexus, a community intelligence system for the Atlanta region that provides data, tools, and expertise to catalyze opportunity for all. So Mike, you'll come up next and again give us some data that hopefully bring us up to speed in terms of the state of play for where things are for DeKalb County at present. Followed by that, then I'll ask you both to come up and be joined by Terry Tucker and Proteet Biswas for a panel discussion about the state of play. Terry is the president and CEO of Frontline Response International. He has spent the majority of his career leading efforts to strengthen individuals and families. Prior to Frontline, Terry was the CEO of Families First, Chief Strategy Officer for the City of Refuge, COO and General Counsel for Georgia Center for Opportunity, and Executive Director of the Sullivan Center. And then he'll also be joined by Proteet Biswas, who serves as Vice President for Homelessness and Place-Based Initiatives at the United Way of Greater Atlanta. He also provides staff leadership to the Regional Commission on Homelessness, which ensures coordination and implementation of the strategies to end homelessness in the region. So, Mr. Mitchell, I'll hand it over to you to get us started, and we look forward to this conversation in this first panel.
Good morning. Good morning. It's exciting to be here. We've got a presentation for you to give you some insight of what's going on in DeKalb County. I've had the pleasure of being able to focus on homelessness for almost 20 years. I've been with the county, and from day one up until today, it's a passion of mine and the staff. A lot of our staff members are here today to help facilitate the panels as well as contribute things. I've got a very significant key manager that we've had along with me for almost 18 years. I've been here almost 20. She's been here almost 18 years. Her name is Melvia Richards, but Melvia will come up in a couple of seconds to provide an overview of the COC, Continuum of Care. We use acronyms a lot, but the COC is the Continuum of Care. We've had that in place for years. We were originally part of the Tri-J, and then we broke apart to have DeKalb focus on its own homeless problems. And that was a good thing for us because we've increased substantially the NOFA allocations we've had over the years, led by Melvia and her team. And so therefore, I'd like to introduce Melvia, have her come up and take you through a slide deck, which will give you a perspective on where we think we are with regard to homelessness. It does take a village, and we look forward to getting input. Sometimes we feel like we're by ourselves, but then sometimes we feel like we have joined by others to help us. But I think today would be the catalyst of being able to move forward with the leadership of Commissioner Patrick by having a town hall to focus on this. There are many examples in DeKalb where we started like this. I'll use the Blight Task Force as an example. Years ago, we would demolish houses every other week by ourselves using many methods. But then there was a focus to bring everyone together. And today, we've abated and demolished almost 650 houses in DeKalb County. That all started with a group like this by being able to come together collectively and put a task force in place and bring focus. So we welcome all of you being able to help us focus on DeKalb as a place where homeless will be eradicated in the near term. So with those remarks, I'd like to turn the mic over to Melvia, have her come up and take you through the slide deck. And I'll stay for the panel, of course, but I want Melvia to give you a perspective in terms of where we are. Melvia?
Thank you, Alan. As our team looked at providing you information, we realized that we had much more information that we could provide to you in 10 minutes. So we have the information available in the slides, but I'll do a whirlwind presentation, and we'll speed through many of the slides that we are here. The homelessness continuum of care in DeKalb County is charged with mitigating homelessness in the area. DeKalb County Community Development Department acts as the collaborative applicant for the continuum of care, and that we provide the administrative end. We assist in developing the strategy, submitting the application to HUD, monitoring agencies, and ensuring that the strategy moves forward. A continuum of care, as you see, is a local collaboration within DeKalb County organized to plan and deliver housing and services that meet the specific needs of people who are homeless, at risk of homelessness, as they move to self-sufficiency. The DeKalb goal is to prevent homelessness whenever possible, when homelessness cannot be prevented, to ensure that it is brief and non-recurring. To look at some of the information each year, DeKalb County presents next slide, please. Each year, DeKalb County, next slide. Each year, DeKalb County conducts a homelessness point-in-time count. We've conducted this count in DeKalb County since 2014, and you can see the result of the count. We've seen a decrease, a peak or a slight increase in homelessness in 2022, with again a decrease in 2023. We counted 438 people who were literally homeless at the point in time count. Next slide, please. The next slide shows you the composition of the number of homeless people on the street divided by people who were unsheltered, the sheltered, and the total. The bar in gray shows the total number of homeless. Next slide, please. To give an annualized projection, we take the number. Remember that the point-in-time count shows you a picture at one point in time. To look at that number annualized, we would say that for 2023, there were 1,226 homeless people in DeKalb County. And again, that includes those people who are sheltered and as well as the people who are unsheltered. To look at the number of people who are on the street in 2023, we see that the number shown at the point in time count, annualized, that number would total 636 people that you would expect to see on the street in DeKalb County in the year. At the time of the point-in-time count, we also conduct surveys to understand some of the issues or some of the reasons that people are homeless, and also to understand some of the efforts that we might need to engage or enforce in order to mitigate the homelessness. We found during the survey that 66% of the people, according to their report, reported that they had some form of mental health problem. And we saw that the dominant disability was mental health among the people who were homeless at the time. To look at the causes of homelessness, according to the reports of the people who were interviewed, their chief causes, according to the interviewees, were economic, family situations, alcohol, drug, and housing problems. When we looked at age, we saw that there were 25% of the people were under age 18, to indicate that we have a problem with homelessness among children. We found that 24% of the people were aged 55 to 64. We also found that 167 of the people counted belonged to families. There were family members in 167, and 271 were single people. In veterans, we looked at veterans because we achieved functional zero several years ago. And functional zero means that basically any veteran who was willing to be housed could be housed in 90 days. We were awarded functional zero by HUD in around about 6 years ago. So every year we try and ensure a look at how many veterans we're seeing on the street. Again, you can see that in 2023 we had an increase. We saw 23 veterans on the street at the time of the point-in-time count. Then to look at, and again, I apologize, I'm speeding through the information. I'm sure our team member who conducted, who was the manager for the point-in-time count is here, Dr. Josie Batchelor, and she can answer any additional questions about the point-in-time count later. To look at how we house people, we thought we'd present you some information on the housing inventory. At the time of the 2023 point-in-time count, we had 189 eligible emergency shelter beds. Those beds were 95% occupied, and we have to keep in mind that some of those beds are family beds, so 100% occupancy could not be expected because some of the space had to be reserved for family members, and so that if, for example, if you had a room for a family with 5 children, and other rooms, and they only had 4 children, that would be one bed that might be vacant, but another family coming in with, say, 6 children who had a child maybe 17, it was not possible always to share rooms for those families, is my point. Transitional housing, we had 32 beds available. They were 97% occupied, and permanent supportive housing, housing choice voucher, rapid rehousing, we had 1,242 beds available, and it was 97% occupied. Next, how do we get people from the street, from homelessness, into those housing, into those beds? In DeKalb County, we used a coordinated access system. We call it coordinated entry. It's HUD system as well. And that system provides for access, for assessment, for prioritization, match, and referral. In other words, people call in. We actually started looking at the system long before HUD mandated we have a coordinated entry system. We put together a panel of agencies, citizens, we hired a consultant. We had meetings for approximately 9 months to say, what is the best way for people to access services in DeKalb County? That committee came up with a plan. About the time that the plan was finalized, we received additional funding, and we tried a system with that funding. We tried a no wrong door approach. We found that did not, while we thought it would be a great system, we found that it did not work well. We found DeKalb County is a very, very large county. People had trouble getting to, even though we said no wrong door, they had people getting to those locations, and transportation was an issue. So we started using some of the tools that we had readily available, and we used a call center. And we found that most of the people who were homeless had access to cell phones, and we could also use our outreach specialists. We have people who but who visit the streets every day to engage people who are unsheltered, to try and build relationships and move them into services and housing, so that we could use 2 ways to have people access our system, through their cell phones or through a telephone system and through outreach. They go into the system, they are assessed to determine whether they are eligible. We have a self-scoring tool that is used for prioritization for certain services, and then they are matched and they are referred out. Next slide, please. To access those services, we have one telephone number, 404-687-3500. At the time, it's open from 9 until 2 because we encountered the same problems that many of you may have encountered. During the pandemic, people moved to other jobs. We had a problem increasing our staff or filling those positions, and we are now in the process of increasing the people in the system so that we can then go back to being open from 7 in the morning until 6 in the afternoon. The sources of funding for my HUD COC grant, about $7.6 million, about $0.4 million from Emergency Solutions Grant. We incorporated funds from ESG-CV, CDBG-CV, some of our COVID-related funding to try and house people as quickly as possible. But that's why it gives you an indication of some of the funding that's available. From the HUD COC grant, part of the problem, $7.8 million, may look like it's quite a bit of money. The issue is that 64% of that funding goes toward permanent supportive housing, and those beds do not turn over rapidly. So that means that there are people who are housed. They may be permanently housed in permanent supportive housing for years, but that is not creating new beds. From a historical perspective, we've engaged in a number of projects to gain experience and knowledge, information on how we can best serve people. Those things we were one of the first areas to look at youth aged out of foster care and put together a system to provide housing to youth who might be homeless except for our assistance. And we engaged youth, provided services, provided psychiatrists, full-time case management to help them move to stability. Households in hotels. We were the first program to actually experiment with households who were living in hotels in order to provide case management services to move them to stability. During COVID, we actually went onto the street, picked up people on the street, took their belongings, took them and had them treated for bed bugs, other pests, moved them into non-congregate shelter, provided new food, new clothing for them, case management to move them to housing. Our goal is, and to move quickly and end, we are also taking home ARP funds at this point, $7.8 million. We are using the information that we've gained over the years, the knowledge, to put together a system to not just help people stay housed or move into housing, but also to put together all of the services that they would need to ensure stability. Our goal in that program is to assist people to move into housing, to prevent homelessness, but to ensure that once the assistance ends, that they remain stably housed.
Thank you so much. As I think we'll experience this morning, this is such a complex issue, and there's a huge amount of data and information. I think hopefully the slides and the information, some of which you didn't get to cover this morning, will be available to people in various ways. And so, thank you as we try to continue moving through and hearing from different people. Michael, please join us and give us some additional perspective from a data perspective.
Thank you. Just like the previous speaker, I'm in the same boat. I have way too many slides for the time allotted, so I'm going to fly through these, and yes, these slides will be available to you. Now, you've heard the numbers about homelessness. What I'm going to do is I'm going to sort of go a little upstream a little bit and talk about housing instability. That's going to be, families that are, one financial shock, maybe two financial shocks away from becoming homeless. And so that's, kind of because the best way to tackle homelessness is make sure that it doesn't happen to begin with. So next slide, please. This is ARC. You can see our vision, our mission, our values, our goals. Obviously, homelessness is going to be embedded throughout all of our goals. Next slide, please. And so I really wanted to start here because I just wanted to get you, where we're at today. And the simple fact of the matter is wages have not come anywhere close to the appreciation of rents, and it's definitely the appreciation in home prices. And so every single day that I make this chart, that gap grows a little bit. Next slide, please. Now, what I'm going to do now is sort of level set you on what we mean by affordability and I'm talking about us eggheads, up at the federal egghead level down to the local egghead level, how we are defining affordability. Next slide, please. Busy slide here, but every single year HUD defines the area median income for places like Atlanta. And you'll see in bold there, for a 4-person household at 100% AMI, that is $102,000. Now, the way that we define affordability is if you're paying more than 30% of that income on housing, you are considered to be cost burden. Now, on the upper part of that slide, you'll see kind of the equivalence of rents that meet that threshold. And so these are maximums. So you'll see a 3-bedroom apartment at 100% AMI is about $2,655. If any more than that, you would be considered cost burden. And so that's a pretty high rent level. Let's just go ahead and admit that. And so that's just sort of the overview of what we're thinking about in terms of affordability. And I'm going to come back to this slide later on. Next slide, please. And I always like to put this in the terms of people. So look at some of these salaries and look at some of the occupations here and see where they fall on that AMI perspective. And I'm really presenting this sort of as a continuum. Not, don't get confused with continuum of care, but sort of a continuum, like a sort of a flow. Because at each level, like from homelessness to the extremely low to very low to low, different housing policies are going to be needed for different parts of the flow. Okay, and so just keep in mind that there's a continuum of policy that's appropriate for each levels. Next slide, please. And this just, again, level setting. This is from the MIT Living Wage Calculator. And this just gives you an idea. And this is just to get by. This isn't a thriving thing. This is just what families need to get by based on your family situation. And what's always shocking to me is this number here. So one adult, one child, and you may not be able to read that because it's real tiny, but it's $85,000 is the income needed. And then that's to get by. And look, we can quibble with that number. It may not be 85. This is just sort of them doing a data exercise. But again, the scale of that should be shocking to you. It's just like, there are a lot of families that are struggling. Next slide, please. All right, so let's talk about renter instability. There are homeowners that are in unstable situations, but we're going to focus on the renters because we're really talking about that upstream, kind of that next step upstream from homelessness. Next slide, please. And this is the situation in the core 5 counties, and you'll see DeKalb County sort of highlighted there in white. There are 65,000 households, renter households, that are considered to be cost burdened. That's more than half of all renter households are considered to be cost burdened in DeKalb County. Keep moving in this table, you'll see that there's 33,000 households that are considered to be severely cost burdened. And what that means is they're paying half of their income on housing, so 50%. These are the households that are in severe danger. Right? I mean, these are the households that are one financial shock, one big hospital bill, one big car repair bill away from becoming very close to or becoming homeless. Next slide, please. And you'll see essentially what this slide is looking at is extremely low income renters, and that's that 30% AMI in DeKalb County and in all the other core 5 counties. Essentially, every extremely low renter household is severely cost burdened. Every one, pretty much. And so that's the scale of the problem that we're dealing with. Next slide, please. And here you'll see, and again, this comes from the National Low Income Housing Coalition. And what they do is they look at, okay, how many renter households are at that 30% AMI level? And here's the, that's going to be the chart to your left. And you'll see it's about 29,000 in DeKalb County. And then the other chart looks at just, just the gaps. How many houses do we really need? And you'll see that, in DeKalb County, it's about 23,000 gap. And so in other words, we have practically no inventory at all to house extremely low income. Yeah, next slide, please. And so this is a map of renters paying more than 50% of their income. So that's that severely cost burden. And what you're looking at is you're looking at the red areas. And what you'll see in DeKalb County, it's not a North DeKalb thing. It's not a South DeKalb thing. There's pockets everywhere where there are severely cost burden renters. These are these folks that are just on the brink of homelessness. Next slide, please. So we're going to come back to this, and you'll see that 30% AMI, and you'll see that at the end, that's 796. So we're going to peg that. Next slide, please. Here are all the rental units in DeKalb County that are renting for $800 or less. You'll look at the red areas. Well, first of all, you look at the blue. That's 0. All right. Next slide. Here are the areas where there's 35% of units. There's just nothing there. Next slide, please. And then we're also going to take that out to, maybe let's look at the 60% AMI level. Then the story gets a little bit better here. Next slide. You'll see that there's lots of, plenty of inventory on the south side of DeKalb, almost none on the north side. Next slide. And we can do the same exercise to where 35% of the units are renting for $1,500 or less. You'll see that there is inventory out there, but it's mostly concentrated in southern DeKalb. Next slide, please. And here's the issue, is that at those two price points that I just went through, the $800 and the $1,500, over the last 5 years, DeKalb County's lost about 42,000 of those units. And every year I make this chart, it gets bigger. So we're falling further behind in just terms of trying to grapple with housing instability.
Is that adjusted for inflation, Mike?
It is not, because it's, and that's a good point. Inflation would, probably, the inflation levels that we've had in the last couple of years will make this a little bit worse. Next slide, please. And then if you look at evictions, and so, evictions are really back to baseline levels. For a while there during the pandemic, we kept thinking about, okay, there's going to be a tsunami of evictions coming. There's a tsunami of evictions coming. Thanks to the moratoria, that didn't really happen. But now that we're in that post-pandemic period, you'll see that evictions are really much back to where they were before the pandemic. And here's the thing, if you're getting evicted in this housing market today, you're considerably more likely to stay unhoused than become rehoused. And so, yes, they're at the same levels they were 2019, but eviction has a lot more consequences today than it did 4 or 5 years ago. Last slide. And this is going back to that point in time count, and this is at state level. And what I wanted to emphasize here is, and again, this is for the state, so it looks a little bit different than the DeKalb data. But look at some of the reasons for homelessness at the state level. You'll see domestic violence, you'll see chronic homelessness, mental illness, substance use disorder. All of that is stuff that really talks to systemic challenges. And so when I talked at the beginning about a continuum of housing policies, some housing, at that very low income level, well, that just requires a lot of public subsidy. And then you get into workforce housing, and that's going to require, kind of gap financing. Yes, some public subsidies, but yes, maybe some private, maybe some down payment assistance. When you're talking about the homelessness, you're talking about a whole nother basket of policies that you have to think about. It really goes beyond what's in that housing policy basket, and it really starts talking about systemic issues, thinking about mental illness, thinking about health, thinking about substance abuse. And so that's sort of the challenge ahead of us, because this transcends your typical housing policy, and you really have to think more holistically about the whole person when dealing with this. And that's all I have, so thank you.
We've heard some really important data at a more kind of 10 to 20,000 foot level. Can you talk to us about what you are seeing on the ground in terms of the face of homelessness that we're facing now from the perspectives of your work and your organizations?
For sure, and thank you, Jeff, and it's been a pleasure to work with him for over 12 years on the ground, and it was actually a really nice kind of an introduction to see all the work that these guys are doing at these levels to kind of understand what's happening. But as they were talking, it made me realize like how long I've been on the ground doing this work, starting with Sister Marie Sullivan, the Sullivan Center, doing the prevention work way back when, and then all the way through City of Refuge and Families First and VEO. And what we're seeing is kind of like a changing face of the unhoused, where back then, people saw homelessness as people that was, a lot of the people that were on the side of the street that were asking for money. They were seeing people that were, succumbing to the increasing in rent and those sort of things. But what we've seen, even over the last several years, is that the increase in the diversity of who's become unhoused. And so this past season, just to give a comparison, as Damon said in the beginning, last season when we opened the warming center at Frontline Response, we had 20 people a night, 20 people. This last season at Frontline, we had close to 130 to 150 people per night. We saw over 7,000 intakes just with our center. And if you look at what Damon had at the rec center and what our partners at New Life had, we had so many people that we were almost maxed out every night. And the surprising thing about it, it wasn't just people that were finding us that were in encampments or on the street. We had families, husband, wife, kids coming in to see us. We had teenagers, 18, 19-year-olds that were homeless. We had a lot of working homeless. We had to be sure they were up at 5:30 so they can get on the bus to get back to their jobs. And we had a significant number of seniors that were unhoused. And so for us, we started to think about how can we continue to be on that front line in that gap, because what we're trying to do is what happens when a lot of the work that these guys are doing fails people and they do end up homeless. A lot of times experiencing something that traumatic can not only impact you from a financial perspective, but it also takes a toll on you psychologically, and you don't know where to turn. And so one of the reasons why I joined the organization is that Frontline is really there to be sure that we have the transportation to go where people are. Go to the encampments. If you don't have a phone, we'll get you to a place where Alan and his team can take over and get you through that work and be with you through that whole thing. But if we don't have those initial bridge type of offerings, a lot of times people don't get to the other services. And as I wrap up, one of the things that we also experimented with that we saw was extremely effective is that in addition to opening the warming center, which was really helpful for people to protect them from the weather, what we saw is that when we extended the warming center and had it open 24 hours, people stayed to get services. We ended up having people making medical appointments, and we took them to the medical appointments. We had people getting tested for various things, whether it's tuberculosis or COVID. We had people able to take showers, get clothing. We had people actually sign up and to go to substance abuse programs because we had counseling people on the site. So for us, as we continue the conversation, we're looking at ways that we can all work together to catch people when they do slip through, to be sure they don't stay. But then we also have to continue these types of partnerships with people that like ProTeep has been doing this for a while that can help provide funding and leadership and people that have the various services, and we all have to do it together. So we had a partnership with people to do what we did over the holiday, and we look forward to continuing to do that.
Great, thank you, Terry. Proteep.
You've had enough data, right? So this is an amazing presentation out there. Thank you. And the message for everyone here. I'll use yours. I always like using other folks' stuff. That's collaboration to the maximum, right? You've heard the data. This was an amazing presentation. Again, for those of you new to the chat or those of you who are coming back, it's been happening in DeKalb County for a long time. The good stuff. The problem's also been there for a long time. But as a community, remember, Melvia mentioned DeKalb has gone to functional zero with veterans. When we come together, work together, right? It's not the first time that you're coming together, but the problem keeps coming up. There's an increase in homelessness that we don't control. Mike's slides on housing, that itself, 23,000 units short. So it's what are we going to do now? In terms of collaboration, even in the funding place, there was this injection, unfortunately, because of COVID, but because of that, we got a lot of resources, the ARP funds. Those federal funds are sort of drying up, right? And there's been also a change in the philanthropic side. So the environment changes, we need to come together. No one entity does it alone. It's not just federal funds, so it's the partnership between public and private partnerships. So really grateful, Commissioner, for bringing this conversation. We need to not only come together in terms of funding, in terms of action, in terms of the players involved, in terms of getting regular citizens. So I'm really thrilled that you have, like, I'd not heard of this Shamli group. I'm looking forward to hearing about it, right? This group of citizens coming together. That's what makes us strong. So I think we hope this conversation continues. We want to be part of it. There's always a crisis. There's always too many folk demanding resources. We get it. We can complain about it all day, but it's the solutions that come. So I see a lot of familiar faces, SVDPs here, helping families in motels. Again, doesn't have to be the only one. We can come together and work on it. There's a home for everyone in DeKalb that's pulled together and got a house, right? Again, folk in DeKalb have been doing this, so thank you for getting energized again. We need to be intentional, and it's not just DeKalb. We need to be able to pull resources from everywhere, but it starts in your county.
Great, thank you very much. So we've got time for maybe like 2 very quick questions. Do we have anything?
If anybody has any other questions, I'll walk around and get it from you.
Do we have any data about how many of our DeKalb homeless are back and forth with Atlanta services?
DeKalb is part of DeKalb is part of the Atlanta continuum, right? And it's a flexible mark, so it's not really, but it's not like people from DeKalb go to Atlanta, people from Atlanta also come to DeKalb. So I think that's a good question, but the data really doesn't tell us anything special.
Right.
We have seen it at the warming center, and it's hard to track because people don't have existing addresses. So you can see kind of where they're coming from. But we noticed that there was probably, of the 126 people or 130 people that we have, we would probably have upwards of 26 or 27 people that we know that came from other areas that travel to DeKalb. So that's kind of like what we're seeing. We're going to look at putting more things in place to kind of be more specific on that.
Alan, can you speak to that?
I'll take this one. I think I heard the question, but I'm not clear on it, but it has a reference to, could you restate the
Just the
question?
data in regards to the back and forth for our DeKalb homeless back and forth with Atlanta services.
Okay. So from our perspective, what we've seen is that there's a proliferation of homeless individuals from various jurisdictions. So because of the access to water and other facilities, you can easily get to DeKalb, and DeKalb is viewed as being more friendlier. So what we tend to have is a lot of individuals from other jurisdictions are being placed in DeKalb. We have the largest amount of hotels in the state of Georgia. As you indicated, per ARC data, our rents tend to be a little bit lower. So why not come to DeKalb? So what you find is people being placed in lower rental units because they don't exist in other areas. Point one. Point two, if you get into the hotel, extended stay algorithm. Hotels here are less expensive. Probably a lot of you can go buy a hotel for the prices in DeKalb, whereas in other counties you can't do that.
Yeah.
So as a result of that, we have agencies putting people in DeKalb because economically it makes sense. So as a result of that,
Yeah.
it has, so we welcome them to be positive, but it does have an adverse effect on the sustainability in communities by having economics positioned in such a way so that other jurisdictions can put people here.
Yeah.
So we do see a lot of transition from other jurisdictions to DeKalb County for those two reasons.
So let me ask one more because we need to take a break here. So if you can, maybe we can get a couple of 30-second answers to this. What are we seeing on the ground in terms of aftercare and after folks are housed in terms of needs and opportunities there?
Not enough. Does it reduce recidivism when that is happening?
Does it reduce recidivism is the question? Yeah.
I can, and Jeff and I have done a lot of the research on this, and this is one of the reasons why the approach, there's a slide, that last slide, if you guys have it, you can throw it up there. When you come together collectively and you do the aftercare, Brookings Institute did a study, and if you hit all of those points and keep those people in the system, they usually have about a 7% chance of recidivating back into homelessness. For every one of the points that you don't hit, and those impact measures, and some of them are like making sure that they are making 250% of the federal poverty level, making sure that they're reunited with their family, making sure that they are going to their appointments. If you don't hit those things, every time you miss one of those things, the probability of it going recidivating goes up to the point to where there's almost a 95% chance if you don't get that aftercare, you're going to be back homeless again. And what ends up happening is that you waste all of that. I don't want to say waste. It wasn't the best use of all of those funds when everybody came together because you didn't do it in a collective fashion and you didn't focus on the actual points that you need to be sure that someone is prepared for the new homes. Unfortunately, even over this last month, we've placed probably 30 to 40 people in permanent housing, and they didn't get as much wraparound services that they need, and they weren't able to keep them. We're seeing that just happen in a matter of months. So the better we can keep them with all the other agencies and the work like what the Continuum is doing, they can probably stay unhoused a lot longer.
I'm going to stop us there. We will have opportunity for more time for Q&A at the end with a number of our panelists. And so in the interest of time, I'm going to stop us there. But I know there's more questions here and more questions that are in the audience. Can we thank our panelists for this?